September 19, 2016, 3:39 p.m. Last updated, September 22, 2016, 6:29 p.m. For more than a decade, members of a little-known group called the Painkillers Forum have blanketed Washington with messages touting prescription painkillers' vital role in the lives of millions of Americans, creating an echo chamber that has quietly derailed efforts to curb U.S. consumption of the drugs, which accounts for two-thirds of the world's usage. In 2012, drug makers and their affiliates in the forum sent a letter to U.S. senators promoting a hearing about an influential report on a crisis of epidemic proportions, pain in America. Few knew the report stemmed from legislation drafted and pushed by forum members and that their experts had helped author it. The report estimated that more than 100 million Americans, roughly 40% of adults, suffered from chronic pain, an eye-popping statistic that some researchers call deeply problematic. Deaths linked to addictive drugs like OxyContin, Vicodin, and Percocet had increased more than fourfold since 1999, accounting for more fatal overdoses in 2012 than heroin and cocaine combined. The letter made no reference to another health issue that had been declared an epidemic by federal authorities: drug overdoses tied to prescription painkillers. Deaths linked to addictive drugs like OxyContin, Vicodin, and Percocet had increased more than fourfold since 1999, accounting for more fatal overdoses in 2012 than heroin and cocaine combined. An investigation by the Associated Press and the Center for Public Integrity reveals that similar feedback loops of information and influence play out regularly in the nation's capital, fueled by money and talking points from the Painkillers Forum, a loose coalition of drug makers, trade groups, and dozens of non-profits supported by industry funding that has flown under the radar until now. Hundreds of internal documents shed new light on how drug makers and their allies shaped the national response to the ongoing wave of prescription opioid abuse, which has claimed the lives of roughly 165,000 Americans since 2000, according to federal estimates. Painkillers are among the most widely prescribed medications in the United States, but pharmaceutical companies and allied groups have a multitude of legislative interests beyond those drugs. From 2006 through 2015, participants in the Painkillers Forum spent over $740 million lobbying in the nation's capital and in all 50 state houses on an array of issues, including opioid-related measures, according to an analysis of lobbying filings by the Center for Public Integrity and AP. The same organizations reinforced their influence with more than $140 million doled out to political campaigns, including more than $75 million alone to federal candidates, political action committees, and parties. That combined spending on lobbying and campaigns amounts to more than 200 times the $4 million spent during the same period by the handful of groups that work for restrictions on painkillers. Meanwhile, opioid sales reached $9.6 billion last year, according to IMS Health, a health information company. You can go a long way in getting what you want when you have a lot of money, said Professor Keith Humphreys of Stanford University, a former advisor on drug policy under President Barack Obama. And it's only when things get so disastrous that finally there's enough popular will aroused to push back. Obama gave his first speech on the opioid epidemic last fall. In July, Congress passed its first legislation targeting the crisis, and election year package intended to expand access to addiction treatment. But the law includes little new funding and no restrictions on painkillers, such as mandatory training for prescribers, a step favored by federal advisory panels. Obama administration officials say they have tried to strike a balance between controlling the harms of opioids and keeping them available for patients. "We did not want to deny people access to appropriate pain care," said Michael Botticelli, Obama's drug czar. "We were all trying to figure out what the balance was, and that's still the case going forward." Painkillers are modern versions of ancient medicines derived from the opium poppy, also the source of heroin. Painkillers are modern versions of ancient medicines derived from the opium poppy, also the source of heroin. Prescription opioids were long reserved for the most severe forms of pain associated with surgery, injury, or terminal diseases like cancer. That changed in the 1990s with a surge in prescribing for more common ailments like back pain, arthritis, and headaches. A combination of factors fueled the trend, including new medical guidelines, insurance policies, and pharmaceutical marketing for long-acting drugs like OxyContin. The drug's manufacturer, Purdue Pharma, pleaded guilty and agreed to pay more than $600 million in fines in 2007 for misleading the public about the risks of OxyContin. But the drug continued to rack up blockbuster sales, generating more than $22 billion over the last decade. Despite having no physical address or online presence, the Pain Care Forum hosts high-ranking officials from the White House, Food and Drug Administration, and other agencies at its monthly gatherings. Purdue's Washington lobbyist Bert Rosen co-founded the forum more than a decade ago and coordinates the